Hi, everybody. Pete Delatorre, the CEO of Camacol Talk, and welcome to another edition of Camacol Talk. Today's program is brought to you by Career Source, the City of Doral, Baptist Health South Florida, City Place Doral, and Equitable Advisors. This is Heart Month, the month of February, so we are going to have a conversation today with one of the top cardiologists in South Florida, Dr. Socrates, Kakoulides, who is going to share with us some facts, meaningful information on something that we all have, which is a heart. And we're going to talk about some of the testing that they're doing today to try to get to the root of any issues that may be existing. So let's sit back and watch that conversation now. All right, as promised, welcome to Camacol Talk, Dr. Socrates Kakoulides. How are you doing there, my friend?
Doing really well, thank you.
In celebration of Heart Month and our ongoing partnership with Baptist Health South Florida, we're going to talk about something that's near and precious to all of us, our hearts. It drives our lives. It is the epicenter of our lives, really, when you think about it. And Dr. Kakoulides is going to talk about some, I think, more than anything else, how to prevent heart disease, how to take the correct measures, the correct testing to get to the bottom of whatever an issue might be, or to find out that everything is fine. Before we get into that conversation, Doctor, can you give us a little bit about yourself and your background?
Yep, I'm a cardiologist. My training is particularly in echocardiography, that's ultrasounds of the heart. I was born and raised in New York, and I've been here in Miami for about 3 years.
You have a very poetic name. Were your parents, how did that come about? That's really cool. Were your parents inspired when you came to this earth?
Yeah, it's a family name, so it was my great uncle's name, my dad's favorite uncle's name, but it's been, with a name like Socrates, it's something you definitely have to live up to. So I've learned a lot about my namesake and all of his wisdom.
Well, when I got your information from your colleagues, I go, man, I've got to step up my game now. Making sure that I'm sharp and I'm focused, and that my wisdom, that I can bring out whatever I can, so that we can at least be on par. So
the best thing that Socrates said was, "What makes me the wisest is that I know nothing. That I know nothing." So I hope I can offer just a little bit more than that today, with a little bit of cardiovascular information for our listeners, so that they can learn about how the heart works and how they can prevent cardiovascular disease.
We had a good conversation yesterday in preparation for today's conversation, and we were all over the place because I was asking you questions from all over the place. Heart disease. It can and runs in so many families, correct? It's something that's genetic?
Absolutely. There's many different components and causes for heart disease. There is a genetic component, something that you're born with. That's a what we call a non-modifiable risk factor. So that's something that you just can't change. And that is inherited from a family member. But there are a lot of things, modifiable risk factors, that you can change. And that's what we try to focus on when we counsel patients about how to prevent heart disease. We go into a detailed family history so that we can understand their risk. And then we also talk about lifestyle changes that they could potentially make to help prevent heart disease.
Yes, I mean, you hear a lot of stories of famous people, actors, singers. There was a guy came out in the late 1950s, Bobby Darin, I believe was his name. And I'm sure you read about his case study. I think he had a heart issue since he was a little boy, and he carried that, and he lived much, much longer than anyone had expected. But I think he was late 30s or right about 40 years old. And sadly, he passed away because his heart just gave out. And so that's an example right now of either being born with a situation like that. My cousin had a little girl that was born with a heart issue, Bless her heart, she fought like crazy. I don't know how many heart surgeries, but gave out when she was 8 years old. And the courage that she displayed, and of course, the family was very, very hard to take. So these are the things that are just there when you're born. But there's, as you just mentioned right now, there are things that we're doing to ourselves to elevate our risk factor. And what we want to do now in the next few minutes is talk about, how to get in front of this, how to prevent, what are the things that we can do, and what are the ways that are used today with technology, how to go through a series of tests in order to find out what's really going on. If you could share a little bit about with us today.
Yeah, I mean, I think you're raising a really good point with regard to and separating those who are born with certain conditions that make them at risk for developing heart disease or having trouble early on in life. And then those, and for the majority of us, it's a lot of what we do to ourselves and the ways that we can live healthy lives, and the things that we need to know to be able to live healthy lives to prevent heart disease later on in life, whether it be in our 40s or 50s or 60s. And there are certain interventions that we can take. And the American Heart Association and the American College of Cardiology really lays it out, the key steps that you need to do. One important step is to know your cholesterol numbers. So seeing your primary care physician, this doesn't necessarily need to be a cardiologist, but following up with a primary care, making sure that you have a good primary care physician who checks your cholesterol levels so that you're appropriately screened and so that you can understand your risk for heart disease. And that can happen as early as your 20s and 30s. The other thing is controlling your blood sugar, making sure that you're avoiding refined sugars, that's, sweetened sugary beverages, or as we see here in Miami, we have a tremendous sweet culture, which is delicious but dangerous for us.
Mm-hmm.
And we have to curb that to make sure that we're not taking in too many refined sugars. The other thing is avoiding toxic habits like smoking, which as a country, we've gone a long way to help prevent heart disease by reducing the amount of tobacco smoking, but we still have many patients, and I see it every day, who have smoked for a long time and exposing themselves to heart disease. So taking those risk factors, those things that we can control, and making sure that that we are taking the steps to live healthier lives. One important thing, which I think we talked about yesterday, is how to reduce stress in our lives. And sometimes, especially during this COVID period, it's been very difficult for us to really change this stressful situation that we're all going through and we're all experiencing, whether that affects us with our children at school or the stress that we're undergoing at work. But making time for us to do things that can help us de-stress, like exercise. Trying to get 20 to 30 minutes of exercise 4 to 5 days a week can really go a long way in improving your cardiovascular health. An important thing that's kind of easy to do, but a lot of people struggle with, is sleep. So, getting good sleep can really go a long way in preventing hypertension and improving your cardiovascular health.
Yeah, you just mentioned COVID, the stress level that COVID put on all of us in so many different ways. And especially during the lockdown, the 3 months or so that we were locked down, and the consumption of food escalated quite a bit. And a lot of that food wasn't necessarily the healthiest food. And the consumption of alcohol increased because, again, the anxiety of not knowing what was going on and what was next and what was going on. So, and the thing about it is that there is stress that we know in advance how to avoid, because it's in we're accountable, we're responsible, we take ownership. COVID was one of those things that we were scratching our heads. How could it have happened? We didn't ask for this, and so that takes that stress to a whole different level. Which and for so many people, when they're stressed out, what do they do to kind of calm themselves out? They eat. and it's not even eating healthy. They eat, junk food and and so that multiplies several times over. So it's I'm sure that you saw the increase in cases and heart issues and things like that. So I think the mindset is so important in all of this, and it's being sensible. And you mentioned the three things. You mentioned exercise, you mentioned nutrition, and you mentioned sleep. Sounds easy, right?
Yeah.
But we complicate things. We make it hard on ourselves. What are some of the more advanced testing methods that are being used today to that maybe weren't around possibly 20 years ago?
Yeah, no, these are really good points. So there's a lot that we can do with just routine blood work, but to know our cholesterol numbers, but there and help us understand our risk for cardiovascular events. But there are other studies that we can do to refine that understanding of our cardiovascular risk. One of them is a calcium score, calcium CT score, which can measure the amount of calcified plaque that's in the arteries of the heart, and then compare you to other people your age and to see where you are in the spectrum and your likelihood of having a heart attack in the next 5 or 10 years. And that can really help us not only better understand your risk, but then target therapies based on your risk.
And that's an interesting point because there isn't one size fits all. Uh, if you've got heart, you have a condition or something's hereditary in the family, there are different things you need to do at different times of your life. If you're younger, I guess there's a certain process of testing as opposed to someone that's middle age or a little bit older. So is that pretty much correct? Is depending on where you are in your life, the testing that you go through?
Yeah. So if you're on the younger age, your risk of having a heart attack or stroke is relatively low, and so a calcium score probably isn't particularly helpful. You very unlikely have calcified plaque. On the other end, if when you're much older, you likely already have calcified plaque. So it's presumed that you have that, and trying to know whether or not you have calcified plaque in the arteries, it won't be particularly helpful. And it won't necessarily help us intervene and help lower your risk of having a heart attack or stroke. We reserve calcium scores for patients who are asymptomatic as well. So if you're not having any symptoms, those are the patients that we really want of heart disease, and in particular of coronary artery disease. We reserve a calcium score for those types of patients. But if you're having chest discomfort, or if there's a concern that you have a decrease in exercise tolerance and that you might have coronary artery disease, and that these symptoms that you're having may be suggestive that there may be a blocked artery, then we would do a stress test. And there are several different types of stress tests that we would use based off of your risk and your ability to exercise. But just getting you on a treadmill and hooking you up to an EKG and watching you exercise can tell us a lot about your prognosis and your risk of having a heart attack or in the future. So if you're having symptoms, if you're realizing, hey, look, this having some chest discomfort, or I can't quite climb that flight of stairs that I could climb a month ago, or I'm starting to get some discomfort or pressure in my chest whenever I do that, then that would be a patient who we would consider a stress
Sure.
test.
You mentioned stress test, and I want to throw a little humor into all of this. I think our stress is tested every day.
For
We go that
sure.
that is a formal way to test your stress, but I think all of our stress is tested every day,
For
some more than others. There, right?
Yeah, for sure. All you have to do is drive down US 1 or I-95, and that's a stress test in and of itself.
Absolutely, whether and you didn't ask for it, and you got to go. You mentioned the word asymptomatic. That has become like a buzzword through COVID. Or you don't show any symptoms. You're asymptomatic. Come in and get tested. And speaking of COVID, um, and it's probably a loaded question. We didn't talk about this. I just kind of crossed my mind now. 2 years into pandemic, epidemic, whatever, we're still living in that world right now. Have you spotted, or your colleagues, any sort of lasting effect to the heart because of one, coming down with COVID? Has that shown anything or way that it's affected the heart after the fact?
Absolutely. The most common cardiac complication that we see with COVID is something called myocarditis or pericarditis, which is an inflammation of the heart muscle or the lining around the heart as a result of the virus and the immune response that you give to that virus. And that causes patients chest discomfort. You may have heard myocarditis as a complication of the vaccine, especially in younger men.
Mm-hmm.
That we actually see myocarditis in COVID patients quite not infrequently. And we see it, obviously, we see it in greater numbers with patients who get the virus as opposed to the vaccine. So why we recommend patients to get vaccines, because the risk of myocarditis is higher in patients who get the virus, who get the COVID virus. The patients can vary in terms of how sick they get with myocarditis. Some can get very, very sick, especially as a result of the virus. Usually pericarditis is a self-limited course where it causes a significant amount of chest discomfort and is often patients assume or think that they're having a heart attack because the pain is so severe. But it can be treated with anti-inflammatory agents to help suppress that immune response that's happening in the lining around the heart. We see a lot of patients with tachycardia syndromes, so that are either arrhythmias or just fast heart rates after COVID-19. One particularly dangerous vascular complication that we see with COVID-19 is pulmonary emboli. So those are clots that begin anywhere in the veins, either in the legs or further up,
Mm-hmm.
that embolize and go to the lungs, and that can cause significant lung compromise. And we see that in higher incidence in patients who have COVID-19. We also see increased rates of heart attacks and strokes. So with patients who have risk factors for heart disease, who then subsequently develop COVID-19, those patients are at higher risk for developing these types of vascular complications, which can cause significant morbidity and mortality. So COVID-19 really wreaks a havoc on the vascular system and has kept cardiologists quite busy over the last 3 years.
I can imagine. For the benefit of the viewers and listeners, this has not been a session about scaring you. This has been a session about opening up your eyes, of sharing facts as opposed to a lot of myths that's out there. So you've done a great job with that, Doctor. We really appreciate the time you've taken today to be with us, and I wish you continue great success. And I know that you are serving the needs of the community in a very, very good way, in a very, very wise way. Okay.
Thank you. No, it's a pleasure being with you. And I think likewise, you are offering a wonderful service for the community of Miami, offering this sort of health information and making this available to your viewers is a great service. So I appreciate it. And thank you so much for having me on.
Thank you for being with us. And we got to bring you back at some point down the road. Thank you.
Absolutely, would love it. All right. Take care.
All right, take care. Bye-bye.
Thank you. Bye-bye.
A big, big heartfelt thank you to Dr. Kakoulides, who shares some much, much needed information that benefits every single one of us. I want to thank you for being part of this program again. Keep letting us know your feelings, your feedback. We want to make sure that we can continue to inform, inspire you. And as we focus on the South Florida community, the business community as professionals, that's what we do here on Camacol Talk. I'm going to ask you to follow us on all social media platforms and let's just work together to make sure that we can continue to have a great year. I want to thank each and every one of you personally, and just have a fantastic weekend. Take care, and God bless.